my name is Caitlin Peterson. Do you know what the acronym ACL stands for? Well, these three letters stand for anterior cruciate ligament, which is also the small ligament inside your knee that is responsible for roughly 80% of your knee stability. Yes, you can live without an ACL, but this ligament is very crucial. Today I'll be informing you on what the ACL is, what different types of ACL injuries there are, as well as the recovery process that follows. To begin, I'll give you a little background knowledge about what the ACL really is. The knee is formed by the femur, which is your thigh bone, the tibia, which is your shin bone, as well as the patella, which is your kneecap. These bones are connected by ligaments. The four primary ligaments in your knee are the LCL, the lateral collateral ligament, the MCL, the medial collateral ligament, as well as the PCL and the ACL. So as you can see right here, this is the MCL and that is the LCL, which they work together to help regulate sideways motions of your knee. And then on the inside is the ACL and the PCL in the back, and these help to regulate back and forth motions of the knee. In the middle of your knee is where the ACL is, preventing the tibia from sliding in front of the femur, as well as limiting the rotational movement of the knee. Without the ACL, the knee is prone to hyperextension, as well as risking injury of other structures in the knee. So, why does this one ligament cause so many problems for so many people? Well, most ACL injuries occur during a sport or fitness activity that pushes the knee to the limits. The ACL tends to tear when landing from a jump incorrectly, pivoting when your foot is firmly planted in the ground, or a sudden change of direction, otherwise known as cutting. Risk factors that can play into why your ACL might tear are joint laxity, hyperextension, and imbalance of thigh muscles. When the injury takes place, you may hear a pop noise, feel slight discomfort, or begin seeing swelling within a few hours. You will also start to experience a loss of range of motion, as well as a feeling of instability. Personally, I've torn my ACL twice. The first time was a very odd incident, and I had no idea what was going on. I felt all the same experiences that I talked about previously, but didn't know what was going on. Because an X-ray can't determine if the ligament is torn, doctors may use an MRI machine to see exactly where the tear is. Even before an MRI is offered, doctors will use two different types of tests to see if the knee is giving way or feels unstable. The first is a Lockman test. The Lockman test is performed having the patient lay flat on his or her back and having the doctor grab onto their tibia. The doctor will then put their hand on the on the femur and pull up and down to see if there's any give or take in the knee. The second is the anterior drawer test. This test is performed by having the patient lay on his or her back and have their knee at a 90-degree angle. Then the doctor will put his or her hands on either side of the knee and try pulling forward and backwards to see if there is any sign of a tear. After the doctor has decided that there is a tear, surgery is the next step. There are two different types of surgeries you can have. One is a bone-tendon bone, basically which means that a doctor will make a tendon autograft out of either your patellar tendon, your hamstring, or your quadricep. The other is a cadaver autograft, which means they will take a different tendon from a cadaver and make an ACL out of that. This is a personal choice as to which one you choose to do, being as some people say one's better than the other, but there is no scientific way of saying which one is better than the other. Physical therapy is a step that most doctors will recommend you do for 6 to 7 months after surgery. Physical therapy is helped to strengthen the knee and gain full mobility back in the knee. Typically, you will be advised to start this process as in little as a week after surgery. For many athletes, this can be a major setback and a career-ending injury. I would suggest that if you are in a sport, you would look into ways to help exercise to prevent this from happening to you. I hope after learning about what an ACL is, the different types of injuries, and the recovery process, you will be able to inform this in your life and apply this to others. Personally, my injury I knew very little about what the ACL did and how the injury took place. Hopefully in time we will start seeing new ways to prevent this injury from occurring, as well as faster ways to help recover.